Each day, each night brings new concern about our healthcare system keeping up with the number of people who need urgent care.
And tonight we have a new perspective about what is happening inside our hospitals. CBS 4's Ty Russell is live at Jackson Memorial Hospital, whose employees just learned their CEO has coronavirus. Ty?
Well, Elliot and Rudabeh, let's talk about some of the folks who are on the front lines. Some of these medical professionals are 65 and older, and some also have other health conditions. And tonight, more people from retirement could be coming back to the workforce thanks to a new executive order here in the state of Florida. And tonight, one doctor talked to me over Skype and said he wants all of them, all medical professionals, especially those on the high risk factor, to be careful.
I'm practicing extreme social distancing.
That's because Dr. Stuart Bussey is high risk to contract COVID-19 and have life-threatening symptoms because of his age. And like many, that's a risk he's taking. As you can see on Skype, he's being careful.
I saw about 5 or 10 patients today. I asked them to put gowns and masks on.
The Miami Beach High alum is now working in California. He told me people have come out of retirement there to help. Florida Governor Ron DeSantis signed an executive order Monday allowing the same. The list not only includes medical professionals, but first responders and law enforcement officers too. Dr. Bussey wants everyone on the front lines, including high risk, to be extra careful.
Go home, use sick leave, take administrative time off if there's any sort of question.
Jackson Health's CEO, Carlos Magoya, has tested positive for the virus. He says he's not showing symptoms. The announcement Monday came days after the hospital dealt with the virus-related death of longtime ICU nurse Araceli Buendia Yagan.
First to fall. And that's hard. She's the first, but she may not be the last. And we just have to be extra careful. Union
President Martha Baker told CBS 4's Jim DeFede even though nurses know they could get sick, that's not stopping them from helping people.
When they call, they don't talk about themselves. They talk about needing, equipment to do their job safely.
Baker says Jackson Health Management assured her they have enough masks and gloves, but she is hearing from employees about their concerns for personal protective equipment, or PPE, to prevent the spread from patients and among employees.
It's not showing up fast enough. They're feeling like it's not there, and I'm trying to convince them and push on management to deliver it faster.
As for Dr. Bussey, he says more testing is also needed for everyone, including health workers, to get a handle on this virus.
World War III, even, if you want to look at it like that. We have an invisible enemy. There's trillions of them. We can't see them, but we have to outsmart them.
It's certainly a battle, and so many people are on the front lines fighting that. Now, Martha Baker also told me a big concern among so many nurses is the fact that you don't know who has the virus. So many people are asymptomatic, and you don't know who has it unless people are tested. And she also said so many workers are actually staying away from their families because they are afraid for their relatives to get the virus if they have it. We are live outside JMH. I'm Ty Russell, CBS 4 News Tonight.